All right, well, local hospitals are now under more and more pressure after having to fire workers because of the governor's vaccine mandate.
The hospitals say that many of those let go were clinical staff like nurses who deal with patients and even a few doctors. Channel 2's Dave McKinley reports on how it's making an already daunting situation even more challenging.
And I'm pleased that we have now 100% of healthcare workers who are working in nursing homes and in hospitals vaccinated.
That's primarily because, under her order, any that refused to take the shot were fired. The remaining ones over the weekend after a federal court rejected religious exemptions. 175 let go at Catholic Health, 100 more at Kaleida hospitals, and another 100 or so at ECMC and its adjacent nursing home, which represents about 3% of their workforce. It's much the same across the state.
But that resulted in a loss of literally thousands of workers that we needed, which is why we have a situation now. One of the reasons we have a situation now to backfill those.
Part of Hochul's solution was to call up members of the National Guard to staff nursing homes. ECMC says it got a dozen, which is about 1/4 of the numbers of workers it had to let go at its facility. All at a time when hospitals are at near capacity, in part due to rising COVID cases, and when they were already short-staffed and have less now. A source at one hospital system says the idea of a test-to-stay system for desperately needed hospital workers who have the best of PPE available to them and who labor in facilities with laboratories and testing kits was communicated to the state, but rejected.
We continue to hire all the staff we can find and incentivize our current staff to come into work for overtime.
But those workers are hard to come by. And the CWA, which recently went on strike against Catholic Health over staffing issues, we wanted to know from them if it pushed back on behalf of those workers which it knew were about to be fired, leading to a worse shortage. Its regional director agreed to speak with us earlier today, but when we called her at the appointed time for an interview, she did not answer, and she has not returned messages. Wait times at emergency rooms at Kaleida's 3 largest hospitals were over 1 hour today. Sources tell us, despite the bind that losing hundreds of staff members at a time like this has put them in, the hospitals did not push back because they believe people, including their workers and perhaps especially their workers, should be vaccinated. Dave McKinley, Channel 2 News.